Hi, good afternoon. Thank you so much for coming and appreciate that. So, if you're a first timer that join us, so this is basically a session dedicated for IMGs. Um, yeah, and unfortunately, this will be our last session. So, if you've got any questions after the sessions, feel free to email us or feel free to um, pop us a comment in the chat box. Okay, without further ado, let's start. So today's topic will be teaching session, um, basically a collaborative learning approach. Um, okay, so this is an example scenario. So the scenario says you're a junior doctor working on a medical ward, and you have been asked to teach a student nurse about interpreting an ECG. To enhance their knowledge and skills. So, as a junior doctor, how would you approach and what sort of thing that you should keep in mind while teaching a student or basically anyone? All right. So, first, always remember to introduce yourselves and build rapport. So, greet the learner and establish a friendly and supportive learning environment. So, you can start off by saying, hi, what's your name? And also ask for their name. And remember to introduce yourself and express your interest in teaching and helping the learner. So, for example, you could say, hello, blah, blah, blah. I'm Natalie, a junior doctor on this medical ward, and I'm excited to teach you about ECG interpretation and help enhance your skills in this area. Okay, basically show them that you're very happy for them to join you and you're very happy to teach them as well. Okay, so the second thing is it's always good to assess their baseline knowledge before teaching them. So you could say things like, before we begin, can you please share your current understanding of ECG interpretation, as this will help me tailor the teaching session to your specific needs, because you want to know how much do they know, and also identify any gaps or misconceptions that need to be addressed during the teaching session, just so that the whole teaching would be much clearer and the objective could be reached to them effectively as well. Okay, so the third one would be a structured teaching approach. So it's always good to provide them a clear and concise overview of what you're gonna teach them, and break down complex concepts into like simpler, easily digestible components. So you always do chunk and checks. So whenever you teach them something new, always ask if they understand. Try to ask them questions, or I could even use visual aids, diagrams, or sample cases to enhance their understanding and engagement. So you can say things like, let's start off with a brief overview of ECG interpretation. So tell them what is ECG for and what do we usually use it on the ward. So it's always good to have a physical ECG with you, just so that you could actually tell them the important points. Um, as compared to you just telling them in words. So me personally feel that having a diagram or picture would be way better in conveying the message they're going to tell them. Okay. So the fourth one would be interactive learning. So you want to encourage them to participate. So you could actually ask them questions, like what I say, chunk and checks, always elicit the understanding about what you just told them, and allow discussions during the teaching as well. And after that, you could actually have hands-on activities. So in general, you just want to foster a safe environment and a friendly environment for the learner to ask questions and seek clarification. So, you could always ask them simple questions based on whatever that you have told them and see how much they understood. And if not, you could always address their doubts. You can always address their questions that they have appropriately, and make sure that you don't sound judgmental when they ask you a question, just so that you're encouraging them to ask further questions if they have any. Okay, so you can say things like, now I'd like you to take a look at this ECG tracing, and can you identify the P waves, Gauss complex, and T waves, and let's analyze it together and discuss what each component represents. So it's best to always, make them feel like you're with them. Yeah. So for the fifth point, I will give it to my colleague. I'll hand it to Oscar. Yeah, thank you.
Oh, hi. I'm Oscar, also one of the FT doctor who co-organized this event with Natalie. So I'm also an F2 doctor now at Pilgrim Hospital. So I'm just going to continue the point where she left, for point number 5, in terms of teaching. So real-life examples and case-based discussion. Always try to use relevant and relatable examples such as patient cases or clinical scenarios to illustrate key points. And number 2, discuss the practical implication and applications of the knowledge or skill being taught. Example like, now let's look at a few examples of common ECG abnormalities, such as tachycardia or bradycardia. How do you think these abnormalities affect the ECG pattern? So showing them what are the other example, what are the other abnormalities. So, you are teaching them the ability to identify abnormalities, consolidating their understanding, and that will make the skill stay with them instead of they just forget it after this session. uh and what sorry, one very important thing is you have to always ask them to consider the clinical context when interpreting an ECG. Factors like patient symptoms and medical history, they do play a quite important role in the overall assessment. So you're teaching them to interpret the ECG of a patient rather than just the ECG itself. Okay, and number 6, always try to assess progress and provide feedback. So what you need to do is you always have to monitor the progress throughout the teaching session. Try to provide constructive feedback and highlighting their strengths or their areas of improvement, and offer specific suggestions for further learning and practice. You can always try to give them like compliment. For example, you're doing a great job interpreting ECG. Or you can say, your understanding is impressive. You know, encourage them, let's continue practicing and discussing more examples to further refine your skills, and or even things like, I'm always around. If you see another interesting ECG, you can always, approach me and then we can talk about it. Lastly, summarizing and concluding the session. So summarize the key points covered during the teaching session, provide additional resources or references for self-directed learning, express appreciation for the learner's participation and willingness to learn. Okay. Example of, to summarize, we cover XYZ of ECG interpretation. I'll provide you with some additional resources like Life in the Fast Lane for further self-directed learning. Thank you so much for, your dedication, your participation to learning, and do not hesitate to reach out if you have any further questions, say things like that. That ends the session by summarizing the points and gives a positive note. I believe it will be really encouraging for the person. Okay, so a mnemonic, basically teaching, just to summarize whatever we have learned today. So T stand for tailored to learners' needs. E, engage through interactive learning. A, assess baseline knowledge. C, create a supportive learning environment. H, highlight key points and concepts. I, incorporate real-life examples. N, nurture progress through feedback. G, guide self-directed learning. So I hope this, you can try to remember this mnemonic or these key points whenever you try to teach someone. And I strongly believe when you join the NHS, you will have people like medical students, or even if you're joining as a SHO, you have F1. If you're joining as a registrar, you have your SHO and F1. So there will always be they will always be asking question, or they might need your guidance from time to time, and it's where you really can share your knowledge with them and build their foundation and make them better colleagues. So they'll be, so eventually it will make your life easier. Okay, so there's only good know-how. And in summary, remember to tailor the teaching session to the learner's level of knowledge and experience. You do not want to be talking about registrar level knowledge to a F1, for example. You wouldn't want to teach a F1 about how to, for example, remove a frontal tumor. Rather, you can talk about things like, how to remove a subdural drain, for example. Consider their learning style and adapt your teaching methods accordingly. Always try to maintain a supportive and encouraging demeanor throughout the session to foster a positive learning experience for the learner. And one thing I see is, you can reach us to ask for feedback as well. Just what we are doing. We're trying to offer some tips and guidance about communication skills, and really appreciate if you guys can fill in the feedback form. Let us know what we can improve, and we probably will do this communication skills session again sometime probably next year, to help more people. And really appreciate if you guys can let us know what we can improve on. So before we end the session, I just want to share quite interesting videos that I find, and we'll discuss it afterwards. Okay, so this video might seem just for entertainment purposes, or it's just funny, but I believe this actually could happen in real life. We could overestimate whatever the learner knows, and not being very not tailoring the content to their needs. So just always be mindful, because we always try to share our knowledge with our colleague, and together we can make the patient care better, and eventually the patients will be the one who benefit from all this culture, a positive culture. Okay. Sorry. Also, thank you very much for joining our session. Really appreciate those who have attended all four sessions. Um, Again, sorry. Just always please try to fill in the feedback form. Give us more feedback so we know how to improve from this. We're just gonna end the recording right now and open the floor for questions.